So osmosis, movement of water against the concentration gradient. So what does that mean? Kind of like when I was talking here, when you were moving against the concentration gradient, but with osmosis, it's a normal law. It doesn't take energy here because it's just what water does. So this is a pipe, and it's bent like that, and you got like a screen down here, and you fill this side up here with gravel or marbles or something, right? Then you pour some water in here. Well, the water can go through the screen, so that's permeable to water. And what you'll notice is their water level here might be down here, but on this side it'll be up here. Now, water usually seeks its own level, right? But here it's boom, it's pulled over here because there's solutes here. There's things over here, and water tends to go to the area that has the greater amount of solutes. So it will flow into that side. That's what water is doing. That's what we're talking about when we're talking about osmosis, is that it's going to flow to the area that had more stuff in it. And this one here, it's using albumin as the example of the stuff. Okay, so what I got here, you look here, the water level's even. But there's a lot more albumin over here than there is over here. I like to think of albumin as a sponge. Right? Think of albumin as a bunch of little sponges, and it pulls water towards it. It's just an easy way to visualize what's happening here. Since you have 10% albumin over here, 5% albumin over here, in order for it to be equal, the concentration of albumin to be equal, water will get pulled into that side. It will get pulled to the side with more solutes. So you look here, it's getting pulled over here, and the water level is higher. It's down here, it's way up here, right? But if you look then, well, it's showing that your albumin concentration would end up being equal once that has stopped moving. Once that water has stopped moving and reached the state of equilibrium. So that's just an important concept. Osmotic pressure, the amount of pressure required to stop osmotic flow of water. In other words, how much pressure there was, right, over on this side. The amount of pressure, if you measure it, it's the amount that would pull that amount of water over there, right? So this amount, the amount of albumin you have over here is creating that pressure. Let's see. It's determined by the concentration of solutes in the solution, right? Like I was just pointing out there. Fluid tonicity is, you got isotonic, hypotonic, and hypertonic solution. So let's say you get a bag of IV fluid here. And then you look at a person's body. Let's just say this is their arm. It's coming down here. So if you looked in here, if you have a hypotonic solution, let's say this is the amount of stuff in it, the amount of solutes. And over here, the amount of solutes in this person's fluid is about that much. Well, this is hypotonic. There's not as many solutes in here as there is in there, right? Isotonic means, and I'll try to get this so it's about even, that you got about the same amount of solutes in here as you do in there. So it's isotonic, right? The hypotonic is going to, fluid, when you put it into the body, it's going to start moving into the cells because the cells have a higher concentration of solutes than the fluid you're putting in. It's going to go into the vessels and then move out and into the cells very easily. Now this here is even. It's not going to move so much into the cells. It's going to fill up your space. The space is there in the intravascular system, move into the tissue and fill that up, right? But it's going to move. It's going to do it like that rather than moving by osmosis. Now let's say that you get a hypertonic solution. Right. Well, that's got more solutes in it than the person's than the person's fluid does. So our own body fluids will be less concentrated than the fluid that we're putting in. So if that's the case, when you put that fluid into the blood vessels, the fluid is going to be drawn out of the cells and into the vascular space. Right? It's going to get pulled into the vascular space because that's where all the solutes are. So you have to be careful when you are giving fluids, especially when they are hypotonic and hypertonic fluids. You have to be careful what's going to be happening there. You're pulling a lot of fluids into the vascular space. You got to look for fluid overload, right? Fluid overload might fill up in the lungs. First thing you probably notice is some crackles in the lungs. So that's one of the important things there. So now when you look at this here, this is a great slide. I really like the way this slide is set up because it's showing here when you get hypotonic, and this is using red blood cells. Now remember, this will happen in your brain cells, it'll happen in all of your cells eventually, but probably the first ones to be affected by an imbalanced solution will be your red blood cells, because they're right there in the vessel, in the vascular space, right, and the blood vessels. So they're right there in the vascular space where you're putting the fluid. So if you look at these red blood cells, if you're given a hypotonic solution, that means that the fluid that you're giving is less concentrated than the fluid in the body. So the fluid in the cells will be more concentrated than the fluid that you're putting in. So that means the fluid's going to move from an area of lesser concentration to an area of higher concentration of solutes, so it's going to move into the cell. And you get these cells all blown up, right? They get very fragile. You can get a hemolysis problem there, right? You can have a lot of death of your red blood cells. So an isotonic solution, fluid's not moving in or out. Well, it can move in, and when some moves in, some will move out. It's balanced evenly. So since it's got the same amount of solids, you're not going to have a lot of fluid shifting in or out of the cells. And this here is showing when you give a hypertonic solution. You're given a hypertonic solution, there's a lot more solids in the fluid that you're giving than there is in your own body fluids. So you put this high concentrated fluid in there, things are going to move out of your cells and into the fluid, right? It's going to move towards the higher concentrated fluid that's in the vessels now, thanks to what you're giving them. And so the cells will shrink, right? So that's just something that happens. So when you're giving these fluids, right, if you have a person here, and here's their brain, spinal column, right, where you have your cerebral spinal fluid. What happens here, if you got what happens with the intracranial pressure is, if you have, let's go ahead and draw this with blue, you have this amount of solids in your body, and you have that same amount in your cerebral spinal fluid, right? It evens out across the blood-brain barrier, slowly of course, but it can, and it will even out. Now, you give a high concentrated fluid, let's say, boom. Boom, 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 boom. So now this is all really concentrated out here, way more concentrated here in the vascular space than there is in the cerebral spinal space, right? So the cerebral spinal fluid is less concentrated than your plasma out here. So what you're going to do is you're going to get shifting. You're going to get shifting from here out to here. And then your brain cells are going to end up shrinking. So you end up with this shrinking brain cells as everything shifts out. That's what happens that's what you have to watch for if you're giving like this 3% sodium that sometimes we give to try to get the person's sodium level back up if they're hyponatremic. So you'll give them this sodium, and this is something that you got to be careful of, that you have to give it slowly, because if you really make your plasma a lot more concentrated than what it is in the cerebral spinal fluid, you can run into problems, right? And that's one of the problems. In fact, that 3% is about the same as seawater. Seawater is around 3-4%, depending on where you're at. It can be anywhere from as low as 2 all the way up to 5, depending on if you're talking seawater that's like up where the freshwater Arctic ice is melting into it and diluting it out, or if you're down by the equator where it's warm and it's evaporating the water out of it, it's more concentrated in the equator. But anyway, seawater at any rate is going to be too salty and too concentrated compared to our body fluid. Everybody knows when you get out there in the ocean, right? Somebody's boat broke down or something and sunk, and they're stuck on a life raft out in the middle of the ocean, right? Always in the movies, happens all the time in the movies, and they're stuck out in the ice, in the life raft in the middle of the ocean. One of them says, I'm too thirsty, I gotta drink that water. The other one say, no, don't do it, don't do it. Well, sooner or later the guy gets so damn dry he sticks his head over the side of the life raft and starts gulping down some of that water. Well, it doesn't take long after that he starts having this problem, right? He's going to get these brain cells are going to start shrinking as the fluid starts moving out of the cells and into the intravascular spaces because of the concentration difference. Then he gets really confused. His buddy tries to stop him, but he pushes his buddy away and jumps out into the ocean there, and he's in the sea, and a shark comes and eats him all the time. Happens every time in the movies, right? So that's something that is a good example of that this can happen. Everybody knows because of watching movies that you can't drink seawater, right? We all know that, and now you know why. On this slide here, what I'm talking about here is how fluid shifts from your vascular space into your intravascular space or into your interstitial space, from your intravascular space to your extravascular space, from your intravascular space to your interstitial space, whichever you want to call it. So, in other words, how the fluids move out of these blood vessels into the spaces around it where all the cells are, and then back into the vessels and it's moved out. Kind of an interesting little story here. So what happens here, you've got fluid coming in. Now, one thing, we've talked about diffusion, all that stuff. We've talked about active transport, and then we've talked about fluid movements with osmosis, but we haven't talked about hydrostatic pressure. Hydrostatic pressure is pretty easy to understand. That's why I don't even really have a slide on it. I figure I'll just tell you what it is. Hydrostatic pressure is the amount of pressure just forced through something, right? You got a screen door, I take a little weak hose and I spray it on that screen door, a little bit of the water is going to go through to the other side from the hydrostatic pressure. If I take a great big fire hose with a lot of pressure and you spray it onto that, a lot of water is going to go through it because it's more hydrostatic pressure, right? So that's hydrostatic pressure. So that is hydrostatic pressure in the arteries. We know that if I cut an artery, boom, it spurts across the room, right? Yeah, it's another thing like put in the movies. You got to think of what's happening here. You've got the heart beating and it's pushing the blood into the arteries. So that's the hydrostatic pressure. You got a lot of pressure in those arteries. And that pressure comes down here and it pushes its way into these capillaries, right? Now, you've got this pulsating pressure. Every time that heart beats, boom, you got a pulse of pressure, and then it relaxes and then it beats again, boom, and every time it beats you got this increased ripple of pressure going through your system, and that's your pulse, right? So you get a heart here. See if I can get this. You got a heart, and it comes out, boom, and when it beats you got that boom, increased pressure, and it relaxes. Boom, when it beats you get the increased pressure and then it relaxes, right? So that's what you got. Every time it beats it, boom, it pushes this ball through there, and there's more pressure in that ball than there is in this spot here that's between the balls. Right? So there's more pressure here in the balls than there is in between the balls. So let's say you got a blood pressure of 120 over 80, right? So in that ball is the increased pressure. That's 120, right? 120. That's that big whoosh every time the heart beats. In here, when the heart is relaxing, you got that period there where you don't feel the pulse, right? You feel that ball. That's the pulse, right? And then in between there, in between the pulse beats, is this pressure, which is 80, right? Now the thing is when we want to figure out how much pressure we have over here in this capillary bed, the pressure has been stepped down. You got these little muscles here that kind of pull back and even that pressure out. So instead of having the pulsating pressure in the capillary beds, we have an even pressure, just going through there. It's not going anymore. It's just you got a flowing pressure that's evened out, and that's your mean arterial pressure. Mean pressure means average pressure. Well, normally if you want to get the average of 120 over 80, you just add those two together and divide it by 2, right? You can't do that when you want to figure out what the pressure is going to be in those capillary beds, because our heart spends twice as much time in relaxation diastole, right? This is systole when it's pumping. Diastole is when it's relaxing. So it spends twice as long in diastole as it does in systole. So as this thing beats, what you got to do to figure out its pressure is you go like this. You say 80, right? That's the relaxation pressure, plus 80, because it's twice as much, plus 120 divided by 3. Right? And that's going to give you your MAP. M-A-P. Mean arterial pressure. 80 plus 80 plus 120. So what it is it is your diastole plus your diastole plus your systole divided by 3. And that's going to give you your mean arterial pressure. If I'm making a test that you're going to take, you're going to have one of those on there. And that's a free, easy question, as long as you know how to do it, right? And remember, that's not pulse pressure. That's your mean arterial pressure. Pulse pressure, all you do is you would subtract 120, 80 from your 120. And now we're talking about pressure. We're going to talk about the amount of pressure coming through these here. That's hydrostatic pressure. It's just the force behind that garden hose going through the screen. It's the force coming through here. And as that comes through, as that is getting pushed through there, and you're going through that capillary bed. Let's say I'm an albumin. I'm going through that capillary bed, right? I'm working my way through there, and I see these slits in the walls, because in the capillaries, the walls are only 1 cell thick, and they slit open, and that slitting open is what allows fluids to get pushed out of them and into the interstitial space. So I'm an albumin, and I'm going through. Boom! I'm getting pushed through here, and I'm just going down through that capillary, and I see fluids getting pushed out into the interstitial space, getting pushed out through these slits between the cells, pushed out here, pushed out there. Fluids getting pushed out. Sodium's getting pushed out. Potassium's getting pushed out. Magnesium's getting pushed out. Small amino acids. Glucose is getting pushed out. All this stuff is little, and it can get pushed out there into the cells. It's good because the cells need that stuff, right? But I'm albumin, and as I go through, I see all this stuff getting pushed out, but I'm too big. I can't fit through those slits. So I go all the way through. I'm watching this stuff getting pushed out, and I just keep getting pushed through, and I end up over here. I end up all the way over here on the venule side, right? The venous side of those capillary beds. Well, all of this stuff has been pushed out, and my presence over here, I got stuff there now, right? Osmosis, fluids are going to get drawn towards the area of higher concentration, and because I didn't fit out there with the rest of the stuff, I'm creating a higher amount of osmotic pressure over here, right? Because there's a lot more solids. It's more concentrated by the time it gets over here than it is in the interstitial space, because all these solids didn't fit out there. So big old albumin gets over to the other side. Now albumin's a sponge, right? Albumin, SpongeBob. So albumin gets over to the other side, and he pulls that fluid. Fluid has been pushed into the interstitial spaces from hydrostatic pressure, pushed into the interstitial spaces, and then pulled back into that vein side because of oncotic pressure created by the albumin that stayed in the veins, right? So that's how fluid moves out of the vessels and back into the vessels. And if you have a test that I make, there's definitely be a question asking you about that. So that's the story of osmosis, and that's the importance of albumin. One of the things we're going to be talking about albumin a lot. Albumin is a very important protein.